Now, those indirect peace talks between Israel and Hamas are taking place in Egypt, and it comes, as we've been saying, 2 years after October the 7th attacks. Well, let's speak now to Professor Nick Maynard, who's a volunteer surgeon for the Medical Aid for Palestinians, who's been to Gaza numerous times. Professor Maynard, thank you so much for being with us this morning. Let's just begin by your reflections on what you saw working in Gaza.
Yeah, well, thank you very much for asking me on. This is a very sad day. We must remember, of course, the tragic, appalling events of October the 7th. But we must also remember what's been happening since then. And I have been out to Gaza on 3 separate occasions over the last 2 years, and most recently returned at the end of July from a spell at Nasser Hospital in Khan Yunis. And I bore witness with my own eyes the appalling humanitarian catastrophe, the genocide that's been carried out. And each time I've been to Gaza, it's worse than it was the time before. And I am encouraged by the peace talk, the negotiations that are going on, and just hope, we all hope and implore that there's a ceasefire as soon as possible.
Now, you say it worsened over the time that you had gone, the 3 different occasions you had gone. Describe for us how it had gotten worse. I mean, was it a lack, an increasing lack of equipment, being able to do your job properly? Was it an increasing ferocity of the fighting? How did it?
It's a mixture of things. I mean, the traumas we saw, the killings of civilians, the appalling injuries from explosive injuries from the bombs, increasingly gunfire and gunshot wounds in young people, the huge numbers of small children I saw who'd been killed and critically injured, and women and men, of course. So the injuries were getting worse each time I was there. But, of course, the lack of resources to treat these patients was getting worse, so we were operating, trying to provide surgical and medical care under the most appalling conditions. And I think the other thing that got inestimably worse over the 2 years has been the malnutrition and the profound effect of the blockade of food and aid going in, the profound effect of the malnutrition on the people there and the ability for them to survive the injuries they were receiving.
Professor, you've been in and out 3 times. Obviously, your colleagues, some of your Palestinian colleagues are there, haven't been able to leave. Give us a sense of how they've been able to do their work. I mean, I presume there are still surgeons there, people who are equivalent to you, who are trying to do the work with absolutely no resource. Yes,
I mean, I go in there for up to 4 or 5 weeks at a time and find it mentally and physically exhausting. Of course, they've been practicing like this for 2 years, so they are on their knees, both physically and mentally. Many of them have been killed, as you know. Many of my friends have been killed, severely injured. There have been more healthcare workers killed per capita population in this military assault than ever before. So I think the healthcare workers are on their knees and struggling against all the odds to provide a humanitarian service for their population.
You said you last came out in July, is that right?
That's correct.
Now, in the early stages of this war, in the first few months of this war, we were sort of counting, paying close attention to which facilities were still operating, which weren't, and there was a decreasing list. It's hard at this stage to know exactly how many facilities are still functional, are still able to treat patients. Give us a sense of where people can go to be treated.
So every single hospital in Gaza has been directly attacked by the Israeli military. I was most recently working in Nasser Hospital, but I've worked in other hospitals during the last 2 years. Nasser Hospital is the last remaining medium to large size hospital. It's the last hospital almost certainly capable of dealing with major trauma. But even Nasser Hospital is functioning at a low level compared to what it used to. It is saturated with patients. It's well over capacity. As I mentioned earlier, the resources are very, very limited, and it's unable to provide the service that it could do prior to October the 7th. And that essentially means that many people will be dying who could otherwise have been saved.
Now, the IDF say they attack hospitals because Hamas use them as areas to fight from. They have bases within, underneath. From your time there, did you see Hamas fighters operating from medical facilities?
No, I didn't. And it's disappointing to hear that this is still being raised by the media in our country. The Israeli military claim this, but you will know as with all other media outlets know, that there has been no verifiable, no credible evidence to support those claims. I have borne witness, as indeed many other healthcare workers have, repeatedly over the last 2 years, that none of us have witnessed any evidence of Hamas militant activity in the hospitals. And I will state again that the evidence from the Israeli spokesman is lacking. There is no verifiable, no credible evidence to support those claims.
Professor, when we look at the potential of this peace deal, we talk about the rebuilding of Gaza. How do you go about rebuilding a healthcare system? I imagine the healthcare system in Gaza was inadequate prior to this because of the Israeli blockade. How do you, going forward, rebuild a healthcare system that is adequate for the millions that live there?
It's a vast task. It's been a very challenging environment for many, many years to provide healthcare, as you quite correctly say. But they managed to provide a very high level of medicine. And indeed, in my specialty is cancer care. I've been going out to Gaza for many years, helping with cancer surgery out there. And they had made great strides in their development of cancer services. That's all been destroyed now. I think the rebuilding of the healthcare system is a mammoth task that the whole world needs to turn to in terms of funding and providing support. But it needs to be led by the Gazan, by the Palestinian healthcare workers. They need to drive the rebuilding with our help.
OK. Professor Maynard, we've run out of time for our conversation, but I really do appreciate you joining us this morning, and hopefully you and I will speak again very soon. Thank you for your time and for your work. Thank you, Professor. All right.